Mayor Turner, we'll start with how are you feeling?
I'm feeling okay. I mean, I'm better than I was several days ago. I've never had a fever, no shortness of breath or fatigue. I do have a cough and what I thought was sinus allergies that turned out to be COVID. So, but I'm doing much better. I will tell you the booster does help. I can certainly tell you that.
Well, you look well considering all things. When did you first start feeling differently, Mayor? When did you notice things changing?
Overnight on Thursday night, let's say after midnight when I laid down, um, I thought it was sinus drainage, and I've experienced that in the past. But then it kind of got worse, and then a sort of a itchiness in the throat area. And I knew I had a full day on Friday and a full day on Saturday. And I was scheduled to be the commencement speaker for University of Houston downtown graduation. And so I thought before I got the day started that maybe it would be wise to get checked out. And so that's when I said, let me get tested. And before I got my day started, and I did when I got tested, stayed at home waiting on the results. And then when the nurse called me, she said, Mayor, this time it got you. And then that was it.
You've been tested several times. How often have you been tested throughout this time period, this pandemic?
Mia, I am tested every 2 weeks. In fact, my day to be tested happened to be today on Monday. But because I knew the schedule was going to be very, very busy on Friday through the weekend, I thought it would be prudent not to wait until Monday, especially with what I was feeling. I'm glad I did because I certainly would not want to expose a lot of people, being around a lot of people during the course of the weekend. So that's when I decided to just go ahead and get tested. But I'm tested every 2 weeks, and that's been going on for the past year or so.
And probably tested some in between where you have felt it's been warranted.
I've been, for example, when I was at COP26, I was tested every day. When I'm traveling, of course, you're tested before you get on the flight, and even when you're coming back. So I've been tested, I can't tell you, it's probably hundreds of times during the course of this pandemic. And I've been very fortunate. As you know, I've been around thousands and thousands of people.
Yeah.
But this one got me.
Yeah. Do you think maybe it was keeping up with that rigorous schedule? We know that, COVID comes when it comes, and you've done all of the precautions. You have your vaccinations, you have your booster as well. Do you have any idea, maybe perhaps, where this came from for you?
I'm in looking back, I think of course it was last week. I do recall attending, I attended several events, but I think it was probably in the last week when it happened. I will tell people, and let me encourage, I've always said to people, get the vaccine and get boosted. But let me re-emphasize that from a very personal perspective. Please get boosted. That's critical. But for the booster, I think my symptoms would be, and the severity would be much, much greater. So there's no question, no doubt in my mind that helped. I would encourage people to keep their masks on, even when you're indoors, or quite frankly, right now with the Delta variants and the Omicron variants running rampant, even in our city, I would say keep your mask on if you're around people, period, except when you're eating. And then I would encourage people get tested. That's whether you've had the 3 doses or not. Please get tested.
Mm-hmm. Because if the mayor is susceptible to COVID, so are others. And Mayor, we have an increased threat level now at orange. And we just learned from Harris County about the first Omicron-related death, a man in his 50s. How are you feeling about Houston, Harris County status as of right now and positivity rate?
Well, the positivity rate has increased. I put out an announcement this morning. Last week or so, our positivity rate was under 5. Now our positivity rate is above 7% and increasing. We have 39 wastewater treatment facility plants. You know, we do the wastewater studies, and now we have a detected Omicron in 35 of those 39 wastewater treatment plants, which means that it is all, excuse me, no it is all over the city of Houston. So it is running rampant, but there are several layers of protection, and that is getting the 3 doses, making sure that you keep your mask on. All of those things, the social distancing, all of those things still work. And what I will tell you, with the variant running so rampant, what really does help is getting that third doses. My symptoms have been relatively mild. I feel pretty good, you know, an occasional cough, but the main thing is staying out of the hospital and avoiding, you know, reducing your chances of going to the hospital and dying from this virus. I'm not trying to scare anyone, but the facts speak for themselves. The positivity rate is up and increasing, and the presence of Delta and Omicron are very much in our city.
As evident by the man who we learned who passed today from the Omicron variant. Yes,
and let me tell you, you know, I test as we just discussed on a regular basis. Certainly, if I can get it, then let me tell you, almost anyone can get it. And I know people may say, "Well, Mayor, you're out and about all the time." Well, you know, this is the holiday season. A year ago, we weren't gathering as much. We were standing down. We were engaged in social distancing. We weren't attending the Christmas parties, and you name it. That was a year ago. And I know that there's a lot of COVID fatigue. I got that. I understand that. So now we're gathering even more, which means is that we're going to have to do some additional things. Whether you like it or not, you got to get the booster. That third that third vaccine is critical. That is critical, staying out of the hospitals and staying alive. Keeping that mask on, whether you like it or not, that's very, very important. And so let me encourage people to do that. One of the reasons why I wanted to talk to you and others is that even in my situation, as I get through it and come through it, the good news is that, you know, I'm feeling much, much better. Okay. But this Christmas, you know, I won't be gathering with my family. Of course, I'm isolating from everyone at the current moment. But there are things that we can do, that you can do, to keep yourself and others safe. And quite frankly, the best gift that anyone can give during this Christmas season is the gift of that vaccine and just keeping yourself safe.
Mayor, you mentioned COVID fatigue and so many people experiencing that right now. Do you think you yourself maybe perhaps even laxed up a little bit on those precautions, of course, outside of taking the vaccinations and the booster? Had you laxed up a little bit, or do you think you'd been just as vigilant? What's your message to folks there in doing those things?
Well, you know, there are occasions, you know, and I pretty much carry my mask with me all the time. But I do recall speaking at a particular event in close proximity to some others who were speaking, and we were standing right next to one another, and we did not have the mask on while we were speaking. And the Omicron virus is very contagious. It spreads very, very quickly. And if you give it an opening, it will latch on to you. Mm-hmm. So you can have the mask on in many other locations, but at the same time, if you're in close proximity, and if somebody else, for example, is carrying that virus, they may be sick, and they may still be out and about, may not be intending to spread it, but if they're in close proximity to you, then that virus will latch on to you. So there is a lot of fatigue, and I get that, and I fully understand that. But as much as possible, let me encourage people to do everything that they can to protect themselves, which in effect will help to protect their loved ones and their family members. And that's why you have to engage in the several layers of protection, not just one. And that is the third dosage. For those who haven't gotten the vaccine, I don't know much more what I can say. For those who have gotten the vaccine, the first and the second dose, let me encourage you to get the third. This is a 3-dose vaccine for this virus, not 2 doses, but 3. And if you got the J&J, been more than 2 months, you need to get the booster. So for those persons, it's 2. For everybody else, it's 3. And then at the same time, even if you think, like in my case, it was sinus or allergies, be prudent and take that added step, especially during the holiday season, and get tested, because it may not be sinus or allergies. In my case, it was COVID. And so better to be prudent and not spread it than to assume and be wrong and spread it and then infect a lot of other people. It could be your friends and your family members. And then that other layer of protection is making sure that you keep the mask on, except, when you're eating or drinking. Even if other people in the room don't have theirs on. And I know the peer pressure is strong, okay? Because I faced that situation. But lesson learned, and that is, even if you're the only one, better to have it on than not to have it on. So until we can come through this pandemic, those are the precautions, even though, it becomes inconvenient, uncomfortable, and others don't. It's just better for you to exercise every layer of protection to protect yourself and your family members and friends.
Mayor, I know you're focused on caring for yourself right now. Where is your biggest level of concern going into the holiday and coming out on the other side of it?
Well, my biggest level of concern is that, look, we've been dealing with this for well over 20 months, going on 21 months. And people do get tired, and I get that. And, people don't like the mask, and I understand all of that. But, as we've said before, we may be tired of the virus. The virus is not tired of us. So if given an opportunity, the virus will latch on. So my biggest concern is that we just don't get to the point where we say, oh, to heck with it. If I'm going to get it, I'm going to get it, and that's just the way it's going to be, and then I'm going to be all right. Or, oh, the mayor got it, and it seemed like the mayor is fine, so it's really no big deal. Every person is different, okay? And you may get it, and you may be fine, and that's great. But you also may be the person who get it, just like the person who died from Omicron, and not make it. Or you may end up in the hospital. Those type of things are in large part preventable. Going into the hospital, dying from it, those things are preventable if we get the 3 doses, if you get tested on a regular basis, if you keep your mask on, then you can minimize your risk. And so my biggest concern is that we become so tired of the virus that we just decide, oh, to heck with it. I'm just, I'll take my chances. No, I don't want you to take your chances. I love you too much for it. Great people in the city, love each and every one. Let's not allow the virus to win, okay? Let's make it very, very difficult for the virus to latch on to you others. And so I'm simply encouraging people, just do your part. That's the only thing I ask. Do your part, and then we'll come through it.
Mayor, I'm almost wrapped with you because I want you to take care of yourself. What about the healthcare system? How concerned are you about our frontline workers who are in these hospitals and seeing a surge again?
And let me say to you, and I cannot say enough, I cannot express enough gratitude for our doctors, our nurses, our respiratory therapists. They are simply incredible, okay? There's not enough money in the world to pay them. 24/7 through holidays. They've seen the pain, the hurts, they've seen the deaths, the sorrow, and yet they're taking care of others, and they have to take care of their families as well. And so I can't tell you how much gratitude and appreciation that I have for them. I pray for them daily. In terms of our hospital system, what is interesting right now is that the hospital admissions have ticked up, but not as dramatically as I thought they would have at this time. When I looked at the numbers this morning, it was about 540 in the Texas Medical Center hospitals covering the city of Houston. Now, that number can quickly jump overnight, okay? And we don't want our hospital system to become overwhelmed. The virus, both the Delta and Omicron, they're running rampant. And a lot of people are getting infected with the virus. If for those who have gotten that third doses, then their chances of going to the hospitals are a lot less, which is good. But those who have not gotten the vaccine, okay, and maybe not gotten that third dose, their chances of going to the hospital are a lot greater. So we don't want the healthcare system to become overwhelmed, because what happens then, as we've seen in the previous surges, when the healthcare system becomes overwhelmed with COVID patients, then people that are suffering from other, matters like strokes, broken legs, you name it, they are impacted as well. And so we want to do everything we can to minimize our chances of going into our hospital system. But we have the best hospital care anywhere in the world. You just can't find better care than exists right here in the city of Houston. So we are fortunate about that. But at the same time, our doctors and nurses are tired. They've been dealing with this for 21 months. And that's let me emphasize this. We may be tired of wearing masks, okay? But when you start being tired of wearing the mask and then want to just take it off, think about the doctors and the hospitals who cannot they are tired, but they're still at their post taking care of everyone else. And so if nothing else, be mindful of them and do everything you can to mitigate your risk of going into the hospital system and reducing the impact on the hospital system and the stress and strain on our medical personnel. And for them, especially during this holiday season, and many of them will be working through the holiday season, let's extend them our greatest thanks and appreciation for what they have done and what they continue to do to take care of everybody in our city and beyond.
Mayor, a little bit of cough. I know you said you had some symptoms that felt like sinuses and allergies. Do you think you're hopefully on the back end of this?
Yeah, look, we don't kick COVID's butt, I'm an Acres homeboy, and quite frankly, I feel okay. I've got a call. The good news, and I will tell you, having gotten the third dose and got tested, when I felt those sort of symptoms coming on, those things have helped. So I will retest maybe in a couple of days or so, and then we'll see how things turn out. Or I'll just wait, the 10 days. But I've not had a fever. I've not experienced fatigue. My oxygen, I checked, and I encourage people to get those oxygen meters or whatever you call it that you can get from the drugstore. I've checked my oxygen level. Oxygen level is very high. So, I've never lost my appetite. Now that's
it'll take more than COVID for you to lose your appetite, is what you're saying.
Let me tell you, soup combined with sweet potato pie will solve any problem.
That's your medicine. That's your medicine. I understand. Well, Mayor, sounds like you'll be having a Christmas with the family via Zoom. Am I right? But still have your food.
Yeah, let me tell you that even though, I'm isolating, the fact is, I'm grateful to everyone, very thankful. My faith is strong. So may not be around my family members, but at least my family members are here and I am here. Mm-hmm. So, and that's what I'm saying to someone, to everyone. There are things that we're asking you to do that you may not want to do, like to do. I understand that. But better to be in a position to do those things than to not be in a position to do them at all, because you made some very bad choices or some choices that you regret when you find yourself in the hospital. So don't live a life of regrets, okay? Don't live a life of regrets. Don't end up in the hospital and then say, well, I wish I had. Well, that's a little bit too late now. So don't live a life of regrets. The best Christmas gift that you can give during this season is that third dose, get tested, and provide the safety net for yourself and for your families. It's not what you purchase at the store that matters this Christmas season. It's making sure that you're safe. And then remember that we all have so much to be thankful for. So my Christmas gift to the people in this city is we are very resilient. We've proven ourselves to be very resilient. So let's all go into 22 together and do our best not to leave anyone behind.
Mayor Turner, get better. An early Merry Christmas to you and yours, and we'll talk to you soon. Be well.
Thanks, Mia.
Thank
Merry
you.
Christmas to everybody. Thank you all.